Hello everybody and welcome to today's webinar, The Power of Movement, Ways to Strengthen Mental Health Within the Workplace. I'm Claire Thomas, a health and wellbeing consultant at Westfield Health, and I'm also a qualified mental health first aider. Today we are joined by our fantastic panel of experts. So we have Kathy Lawson, John Booker and Kate Platts. Would you please all like to introduce yourselves?
Shall I go first then?
Yes, go on, Kathy.
Yeah. So I am a mental health and wellbeing coach, a mental health first aid instructor, and I'm also extremely passionate about mental health and wellbeing and raising awareness around this really important topic. So looking forward to being here today. Thank you.
Glad to have you, Kathy. And John?
Hi, I'm John. I'm the Active Spaces Director and Physical Expert for Westfield Health. So for those of you who might not be aware of what an active space is, it's anything in the corporate world from a traditional gym with services like multiple studios, swimming pool, Muga or multi-use games areas, all the way through to studios that operate just the class program. That can be anything from in-person, virtual, or combination of both, all the way to a 3x3 repurposed meeting room where we can utilize that space to do our mobility and movement or reset and recovery spaces that we operate. That can include virtual and VR experiences, depending on the population who are going to access that active space. I think more broadly speaking, your active space could be the forest that you walk your dog in, the park that you do some outdoor training in, or your local swimming pool.
Fab. Thank you, John. Look forward to hearing more from you. And Kate?
Hi Claire, I am Kate Platts. I'm Head of Research and Innovation for Westfield Health in the UK and Europe. My role is predominantly working with our clients to help them understand the unique health and wellbeing challenges, I guess, that their workforces face, because every workforce is different, every workforce has its own challenge. So I work with clients to understand what those challenges are, develop solutions that are best fit for those clients. So I work a lot with John in our corporate wellness corporate gym sector, and also implementing solutions, implementing programs and evaluating how successful they are actually impacting people's health and well-being. So that's what I do on a daily basis.
Amazing. Looking forward to hearing more from you too, Kate, today. It's great to have you all with us today. Before we hear more from our panel, I'll go through some housekeeping points. So the webinar is being recorded and you'll receive a recording shortly afterwards via email. We are live, so hopefully there won't be any technical issues, but if there is, please bear with us. You've joined in listen-only mode, so if you have any questions at all, you can pop them into the questions box and we'll try and answer as many as we can. You should see a question section on your screen. You'll see some resources that you can download in the handout section. These include mental health key findings, posters for your employees about posture and moving more at work. Some great information there. During the webinar, we will be taking a poll to include the audience members and their experiences. The poll is completely anonymous and optional, but we will share the overall results with you. The survey will appear on your screens at the end of the webinar, and it would be great if you could give us feedback as we use this feedback when developing future webinars, so please give us your feedback. So what's bringing us together today? Next week, it's Mental Health Awareness Week, and the theme is Mental Health from Mental Health Foundation is movement. Moving more for our mental health. It's such an important topic to discuss in a world where we've become increasingly sedentary and also often separate mental and physical well-being. Mental Health UK have found that people who take part in regular physical activity up to 30% lower risk of depression. That's a really big figure. And research published in the British Journal of Sports Medicine claims that exercise can be more effective than counselling or medication for treating depression. That is a really massive number there. Today, our panel are going to be exploring this topic and providing you with advice to help you create a culture of movement and ways to encourage employees to thrive more physically and mentally. So what you'll learn today then is understanding the mind and body connection and how physical health can affect the mental health, which is a really important one. The impact of sedentary lifestyles on employees and workplaces' performances. Spotting those signs of poor mental health and those early signs as well. And how employers can encourage movement to create a more resilient workforce. At the end as well, we will do a Q&A section from the audience just to get your opinions, and we'll answer as much questions as we can. So the first topic today then is understanding the mind and body connection and how physical health can affect mental health. According to Mental Health Foundation, nearly 1 in 3 people suffer a long-term physical health condition, also has a mental health problem, most often depression or anxiety. Conversely, people with a mental health problem are more likely to have a preventable physical health condition, such as heart disease. I also mentioned in the introduction that the British Journal of Sports Medicine research found that exercise can be more effective than counselling or medication for treating depression. That is quite a bold statement there. John, you're our physical health expert at Westfield. What are your thoughts on that?
Thanks, Claire. I mean, from my perspective, actually, the truth is it's nothing new. I remember going to a UK Active summit in 2016, and they had Simon Stevens, the then chief exec of NHS England, and he talked about this, if pharma could make this magic pill that reduced stress by 3%, dementia by 30%, osteoporosis by 30%, decreased breast cancer, decreased bowel cancer, prevented depression, reduced stress, and eliminated type 2 diabetes. And if the pharma industry found that pill, it would be a global blockbuster. The only issue is the label on the side is physical activity and exercise. I think from my perspective, there are 2 challenges really. One is, on the whole, why aren't we as active as we probably should be? And then secondly, for global organizations, how can they support their employees to be more physically active? Kathy, I don't know if you want to add anything to that.
Well, I guess coming at things from a mental health perspective, I think it's really interesting to reflect on which comes first. You know, we've heard some quite dramatic statistics there on actually how much activity makes a difference. And sometimes I always think, well, actually, does physical activity improve mental health and mental illness itself? Which is easier to address, the physical health or the mental health? And I know that it's not always easy for everyone to be physical. They may be physically impaired or disabled. And we'll look at some of those things a bit later, I think, as to what people can do. And I know that in my experience, I was working with a lawyer once, and he didn't realize that he had mental health issues until he was at a seminar, and then almost looked at himself and went, oh my goodness, this is me that has depression. And fortunately for him, he was already quite active. And I remember him talking about it and saying, I would go for a run, I'd be crying like a baby and thinking, God, what's all this about? But the one thing that really helped his recovery, which is pointing to the statistics that you're sharing, is the physical activity. He had some therapy and the support of his family as well. It definitely made a difference. And Kate, I think you might have a take on this as well.
Yeah, I was just thinking as you were speaking then, Kathy, about you talked about the support of family, of your friend there. And, you know, so often when we do physical activity, there's a social element involved. And, you know, there's lots of research that says that being in groups, being supported, having social connection when you're doing exercise gives you a bigger endorphin boost, if you like. And actually, I think it's worth taking a moment to just think about hormones, because actually we talk a lot about why, you know, physical activity being important for mental health, but do we really understand why? You know, I think everybody would say, I understand why it's important for physical health, you know, for, you know, strong cardiovascular system, strong muscles and bones. I think most people would be quite kind of familiar with that. But actually, the role of hormones, the role of neurotransmitters in this process is really strong. So when we exercise, we release chemicals, hormonal chemicals, dopamine, serotonin, endorphins. All of this will be familiar to you. And, you know, serotonin is our kind of mood stabilizer, gives us feelings of happiness, well-being. It helps regulate sleep. We've got dopamine, which is our feel-good kind of chemical, which is like gives us sensations of pleasure and satisfaction. And it's one of those kind of addictive chemicals. So the more you have, the more you want, which is great for exercise, because the more you do, the more you want to do. And all of these things have really profound positive effects on our mental health. And the endorphins as well. We've heard of endorphins. You've probably heard of runner's high. You know, when you run, you release endorphins, and they give you these kind of pain relief, stress relief kind of feelings of pleasure as well. So all of those things are how physical activity actually has an impact on our mental health. They reduce stress, they relieve pain, they stabilize our mood, and all of those things are easily, as John said, within our reach by doing some physical activity. So, you know, the combination of this social activity, the release of chemicals, and that sense of kind of reward and engagement has a powerful positive impact on our mental health.
Yeah, it certainly does. And I know if I go to the gym early in the morning, I'm a lot more productive. I'm a lot happier throughout the day. It does really improve your mental health. And I know when I go to the gym first thing, I have a much more productive day than what I do if I don't. So yeah, it does make a massive impact. Moving on from that, I want to talk about the impact of sedentary lifestyles, Kate. The impact it can have on the employees and their workplace performances as well. So the British Heart Foundation found that UK adults averaged 9.5 hours a day sedentary time. And we know that the Chief Medical Officer's guidelines are for adults to be active for at least 150 minutes of moderate intensity per week. And the recommended strength building exercises twice a week to reduce the chances of type 2 diabetes, cardiovascular disease, and depression. So from that research that you've done in your career, what impact does that have on inactive or sedentary, have on employees' performances at work, Kate?
It's a really great question, and it has a huge impact, Claire. I mean, I've done lots of research in this area, lots of surveys of large workforces, and I've found that a typical person who works in an office may spend 15 to 16 hours a day sitting down every day. I've seen this again and again and again. And the main issue with sitting down is that obviously it uses a lot fewer calories than standing up. So just standing up or moving, walking about, burns calories, even fidgeting about burns calories. So we lose that when we sit down, which puts us at risk of weight gain. It's terrible for our posture, even if we've got, you know, lumbar supports, foot rests. It's generally not good for our hip flexors, for our back. So particularly desk-based work is really strongly associated with musculoskeletal pain and discomfort. So low back pain, neck and shoulder pain. These are extremely common. I mean, when I do research with workforces, I usually see, I would say 80 to 90% of any given workforce reporting some level of MSK pain, musculoskeletal pain. There is a difference between diagnosed conditions like arthritis and just general aches and pains, which I think we all suffer from time to time. And I think going back to the point that Kathy made earlier about physical health and mental health linking, you know, musculoskeletal conditions have a huge impact on mental health. You know, very often they're strongly associated. People who have MSK pain also have higher incidences of anxiety and depression. And similarly, the other way around, if you have poor mental health, then it's harder to deal with the pain, the distraction, the lack of concentration and focus that all comes with, you know, with being in pain all the time. So you can see how it's a vicious circle and how it would really have a negative impact on someone's performance and productivity at work, as well as potentially even their attendance at work.
Yeah, 100%. And I think working from home has affected that as well, because, you know, I find when I work from home, luckily my watch tells me to move now. But, you know, before that, I wasn't moving that much. And it does affect how much pain you get in your body, 100%.
Yeah, absolutely. Just to finish that one on, I think, you know, I think the statistic is something like 6.6 million days lost to musculoskeletal disorders in 2023, and it's something like 17 million days lost at work, so lost productivity. So I would say that reducing issues related to MSK pain is one of the best ways that employers could support their workforce in improving mental health and improving performance at work. Yeah. John, 100%. Any thoughts on that?
Yeah, I'm going to refer back to the guidelines again, because I think sometimes they can't always be that helpful when we're looking at personalising what we need to do to get active. I think sometimes those bars maybe are set too high, and we need we need to adapt. Our bodies need to adapt. We might not be ready to hit those parameters. So I think we need to be kinder on ourselves sometimes. So understanding that little and often can give you an accumulation over time. So what you did this week versus what you did last week does make a difference. So I just think, yeah, I think we need to. Sometimes we can be a little bit underprepared when we go into trying to scale new heights and trying to do something different within our daily schedules. It's hard enough, you know, navigating all the challenges and barriers that we do face. You know, families, again, working long hours. You know, all those gaps in your day, you know, are easily filled, quickly filled, and sometimes it's that 5 or 10 minutes that is going to make the difference. So getting up from your desk, as Kate mentioned, just to get some movement, just to get some steps in. If you've got an on-site active space, even if I hear this a lot, if I've got an on-site active space or a local gym that I can go to, it takes me 10-15 minutes to get changed, and then it's the workout, and then it's the 10-15 minutes at the best of times to then get back to the desk, or before or after work. And it's reinforcing the fact that actually even 10-15 minutes now is going to make an impact. So if that's all the time that you've got, and you do need to factor in the 10 minutes before, 10 minutes after, 15 minutes before, 15 minutes after, don't use that as a barrier to say that 15 minutes isn't going to be of benefit. It will.
Yeah, I think even going for a walk, it doesn't have to be hard exercise. I think anything is a benefit. So moving on from that, then we want to support the signs of we want to spot the signs of poor mental health. So while we're talking about employees' performances, it's important to look at the larger impact of poor employee mental health. So research that we have done and conducted over the past 5 years with over 2,000 workers has found that days off work due to mental health is increasing, and the last year averaged 4.8 days off per employee. That's a massive number. An estimated cost to the UK economy of 19.6 billion per year. So 45% of people said that their mental health has affected their productivity in the past year. So if we're looking to improve these numbers in any way, it needs to start with spotting the signs of poor mental health. And I think that's a big topic. Kathy, you are the expert on this. So what advice do you have for managers spotting the signs of poor mental health in their employees?
Thank you, Claire. I think the first one to remember is that managers not to hide behind performance. And sometimes I see managers do this because they're uncomfortable and they don't know how to have a conversation, so they refer it to HR. But I can tell you now that I get loads of HR people coming through my training because they don't know how to deal with mental health either. So it's really important that it's actually good practice. It's part of a manager's role to understand the difference between mental health and performance and know when it's right to have a conversation about performance and when it's right to have a conversation about well-being. Because remember, the people that work for you don't suddenly become poor performance overnight. So if someone's been doing really well and then all of a sudden they're not doing so well, people don't suddenly forget how to do their job. They don't suddenly become demotivated. Probably better to have a well-being conversation that says, hey, what's going on for you? And I think as well that as a manager, be mindful that you are part and parcel of creating a well-being culture where people feel safe to talk about their well-being. And sometimes that means that you as a manager, you talk about your mental health and be willing to be vulnerable and open about what's going on for you. If your managers are not sure about how to have conversations, then train them. There are plenty of trainings available. We do a mental health for managers training that will help them spot the signs. And I think the other big thing to remember about managers is that they are paid to fix. They are paid to solve problems. And so therefore, they think if I have a conversation about somebody's mental health, I'll be expected to fix it. And that's not the case. Actually, it's more about listening, understanding, and finding out what do people need that will help them recover and then be able to perform at their best. If you've got a very large team, then you might think, well, it's a bit more difficult to get to know my people. Well, yes, it may be, but also it's still about how you communicate that will make a difference? Are you willing to talk about your mental health, show your vulnerability, because that builds trust? Well, if they're prepared to do it, then I'm prepared to do it. And if you've got, you know, I think from a previous webinar, people were asking, well, what if we've got shift workers? Okay, well, make sure that you're accommodating your shift workers. And if you are employing mental health first aiders, then make sure you've got a mental health first aider on that shift. And top tip, make sure people know that they are a mental health first aider, because the times I see people saying, oh, no one approaches me, but they haven't told anyone that that's what they do. Make sure all your employees know what resources you have available. Again, I hear it so many times that the organisations say, well, I didn't know we had an employee assistance programme. I didn't know we had these health benefits. I didn't know we had these things. So managers, be aware of what you have available to you, so you know what you can offer to your workers. And I think the other one as well, I'm going to pass to Kate in a second on this one, because remote workers, be more proactive about how you engage with people. You know, just because someone works remotely, or just because you're having conversations on these Teams and Zoom meetings, doesn't mean that you can't spot when someone's not okay. And sometimes it is about asking more questions and not being afraid to say, well, how are you coping? How are you getting on? And because otherwise we get things like presenteeism, Kate, which I think is a good time to bring you in on that one.
Yeah, absolutely. I completely agree. And I think in addition to spotting signs of when people aren't doing so well, you know, as you were saying, Kathy, ask questions, take the time to really understand your people. I think there are even things that managers can do higher upstream. So presenteeism is a great example of that. You know, we've seen a huge rise in presenteeism alongside the rise in remote working, You know, it's much harder to spot when people are perhaps not fit for work. So knowing when people are physically unwell, you know, even if it's just colds or migraines and things like that, and preventing people from working when they're not well, is a big step towards preventing longer term issues with mental health problems. You know, there's a huge amount of evidence that over time, presenteeism has a detrimental impact on both mental well-being and job performance outcomes. So, you know, you really need to try and discourage people from working through sickness, even if they feel, I'm fine to work, you know, it's just a bit of a cold. Actually, over time, if an employee is constantly trying to juggle the emotional and cognitive resources they need to both manage their illness and manage their work, over time, this drains their resources, it drains their energy, and over time, it will lead to poor mental health, which then leads to poor work outcomes for that person. So I totally agree. I think having managers that are able to both spot the signs of mental health issues as they arise, but also even preventing the things that we know lead to mental health problems in the first place is a really good place to start.
Yeah, 100%.
I think, John, you had something to comment on this one as well, about managers role modeling self-care, didn't you? So
yeah, well, funny you mentioned the presenteeism, not through sickness, but I've had the experience in the past of working in an SME as an operations director, and always being on call, and even for me, I remember, you know, I have to go through a little bit of a shutdown process, especially when I take annual leave. I probably don't switch off fully, and my wife's fully aware of this, is after it takes me about 72 hours for me to get everything out and just start to enjoy the holiday. So, you know, when I was in that SME mode, I think I was always accessing emails and spending time away. So even though I was on holiday, I was always engaged in work. So I never really got that shutdown time. And I remember it wasn't until I joined Westfield Health in 2020, and I remember taking my family to Brighton in 2021. And it was the first time where I actually took notifications off emails. I put an out of office and stuck to it, and I told my team that I'd be away from emails. And I went on the Saturday, I got to the Wednesday, and I actually felt a sense of guilt because my two children I was playing with, I actually felt present in the room for the first time in a long time. And I just hadn't had those interactions before to that degree, of that level. So I definitely from experience would highly recommend it. And I think now I tell my team that unless it's nuclear, don't contact me and try and stop yourself.
And that's the best way. You've got to take yourself away and you've got to look after your own mental health. You know, we work a lot. It takes up a lot of hours of our day. So when you have got holidays, you do need to have that switch off time, really. So we've established the link between physical and mental health and why both are so important. And we've discussed how you can spot if your team might be suffering from poor mental health as well. We're going to move on now to talk about how employers can encourage their people to move more. Before we do that, we'd like to hear from you. So we're going to launch a poll. We'd like to know how you currently encourage physical activity among your team members to support their mental well-being. You can select more than one answer if you want to. So how does your organisation currently encourage physical activity among your employees to support their mental well-being? We've got organised regular wellness challenges, flexible working, providing access to fitness resources and programmes. We haven't implemented specific initiatives yet. And another, if you do put other, please try and add your comments so we can answer as much as we can. Please be very honest as well.
I'll be interested to see what the outcome of this one is.
Yeah, me too, because I think it is such an important topic in this day and age as well. And it's good to see how other people and what challenges they are facing.
Yeah. I think as well, it's about finding for organisations what is actually going to work for your workforce if you're providing something, because different people respond to different things, and it's about, well, what is going to work. It's no good putting a table tennis table into a workforce if actually no one plays table tennis or they're not interested at all. So let's find something that actually works for the workforce that you've got.
Yeah, some great answers coming in already. So we'll have a little look at those in a second. And it'll be good to see what the actual information coming out of it is.
I remember when I was a wellbeing manager for a while, one of the things that we used to do walking at lunchtime. So easy to organise. Yeah.
Yeah. I've got a thing now. I try and get up early and go for it. If I can't go to the gym, I'll go for a little walk, even if it's 10, 15 minutes. It does really help. So let's have a look at these then. So it's quite close on a lot of things, really, but it seems to be flexible working is encouraging that physical activity. And I agree with that as well. It gives you more time if you're not down to an office. What do you think, guys, on these results?
I think the flexible working one, Claire, is really interesting, isn't it? Because flexible working in and of itself isn't encouraging physical activity. It's perhaps giving people the time, the permission, and the access, if you like, to do more physical activity. I'd be really interested to know how people are encouraging physical activity through their flexible working policy, for example. But certainly we know things like, especially in the winter, so when you've got very limited daylight and, you know, being outdoors, doing a walk in outdoors in nature has such a positive mental health impact. Having a flexible working arrangement where you can say, well, actually, I'm going to take some time at 11 o'clock in the morning because the sun's come out for an hour, you know, that could have such a profound impact. And I think the implementation of flexible working policies whereby you're giving people not just, you know, different types of hours or working patterns, but you're actually giving people permission and freedom to make decisions about how, when and where they work so that they can build physical activity into their day in a way that's meaningful to them. I think that is a really strong and positive way to encourage physical activity.
Yeah, we've had a lot of comments as well saying when people have put others, so lots of people saying that they do walk-in meetings, which I think is quite popular now. So if you've got a team meeting, go outside and have a walk while you're doing a team meeting, which I think really improves that mental health definitely as well.
When the weather allows.
Yeah. There's no bad weather, John. There's no bad weather, just bad clothes.
Walking meetings can be extremely productive as well, because I don't know if anybody else finds this, but sometimes when you're walking side by side with someone and you're not face to face, you can have very honest, candid conversations. So they can be really productive on lots of levels, can't they?
You tend to open up a lot more as well, don't you?
Yeah.
So it's great to see so many people are already providing ways to support their employees to move more. It's, there's such great results there. Obviously, flexible working is good, but, we had lots saying walk-in meetings. We had reduced the meetings by 5 minutes. So to give people that extra time to maybe go outside and get some fresh air and move that little bit more. The Harvard Business Review study found that physical exercise can improve productivity at work. Even short periods of activity, so just 20 minutes a day, generated resource caravans that contributed to employees' next day task performance and health. With that in mind, Kathy, John and Kate, can you share your ideas with the audience for how they can encourage their people to move more during the day and how this can help their people be more resilient?
I'm happy
Kathy,
to.
do you want to start?
Oh, sorry, was that me?
Yeah,
Okay.
you go, guys.
Okay. So my experience as a wellbeing manager would be that we used to have cycle to work schemes. That's one way of doing it. We used to have step challenges, because lots of people, of course, now have got fitness watches. So you can link them all in. I think Garmin will link it all into different apps, and now you can start to compete with each other. And people love a bit of competition. Anything that involves prizes is always really good. So lunchtime walking, we've already said. And just to bear in mind as well that the thing with going outdoors is that you get a dose of vitamin D. And vitamin D, we need, and Kate was talking about hormones earlier, we need it to promote our serotonin and melatonin, our sleep hormones and our happy hormones. And so we don't produce vitamin D. We need to be outside in UV rays with bare skin for about 15 minutes. So, and we put loads of suntan cream and stuff on, and we don't do that. So actually getting outside, particularly in the summer, and getting your dose of vitamin D is a really good thing that can make you feel a whole lot better. What else? Hi,
Kate?
yes, yeah. Kate, over to you.
Oh, okay. And what can I think about? Well, I think simple things like kind of nudging people towards healthy behavior. So, always encouraging people to use stairs rather than lifts or escalators. That's a really, really simple one. I've already said it once, but I think, again, creating a permissive culture. So if someone really enjoys walking their dog at 9 o'clock in the morning, then let them do it, or at lunchtime, having that permissive culture that allows people to do the thing that they enjoy, that they get the biggest dopamine reward for. And finally, another great one, I think, is company challenges. People love to be competitive with teams in organizations, don't they? So setting up in-house challenges, I hear this again and again when I talk to people in workforces, that the thing they love most was when the company set up a challenge and everyone could join in teams and could compete on steps or some other kind of sport or whatever it may be. That really gets people's kind of social connection going, gets their sense of community and belonging going, and it gets them active. So that's a really good, relatively easy one, I think.
Yeah, definitely.
And just to add on the challenge bit, Kate, I think that can be a very short period. It can be a week or 10 days. You can achieve a lot over a short period of time. So whilst in the build up, you make people aware of the challenge. The challenge doesn't have to be a month long or 2 months long for it to have a significant impact. So that's really good. I think the other thing that I would suggest is don't be afraid to have a pause. Because there's a lot of good things that I see at different corporates and that they're doing for their employees, but there's nothing actually tying it really all together. So I see two groups of people. I see it coming from a people perspective and coming from a resource or real estate perspective. So linking that people and places piece up, I think, is really important for organisations at the highest level, really. I see at some point in the future there being a bit of a chief wellbeing officer type role that oversees like the development of how we get people active, because it involves both areas, real estate and people. So it's a really significant piece when you look at it on a global scale. And again, I think the challenge there is that you've got a high level of personalization that's required versus a high level of scalability that you want to be able to do within organizations, and you kind of need to work on both as a bit of a strategy. So being able to gain insights before delivering products and services will help you make good choices when it comes to what's actually going to benefit. And Kathy, you referred to this earlier, what's actually going to benefit your workforce, rather than having a bit of a cookie cutter type approach to the latest innovation. Let's just get that in, let's just deliver it and see how people go with it. It's better to have a bit of a strategy behind what you're trying to achieve on an active level. Thanks.
Yeah, definitely. And honestly, I think by encouraging people to move more and getting that at the front of your mind is definitely going to improve that workforce mental health as well then along that way. So we've had quite a lot of questions in, so it's now time to answer some of the audience questions. So we've had one question here. So when we're fully absorbed in a project, you might be sitting for 3 hours straight. What are physical and mental signs that we should get up and move around? Any advice on that, John? Okay.
You go, John.
Funny enough, Claire, you mentioned
You're all
this,
fighting for each other. I love it.
Claire, you mentioned this earlier, and it's wearables. Sometimes they can be a bit of a gift and a curse. I think wearables. In this scenario, the prompts do help. They do give prompts when they know you've been sitting still. I see it a lot with how people use it. I'll take sleep as an example. With wearables, I've had conversations with people who said who I've asked about sleep, and they've said, I thought I had a good night's sleep, but my watch said I didn't, so I didn't. And then they feel negatively about the sleep that they had, which they thought was good. So that's where it can go a little bit wrong.
I'm guilty of that one, I got to be honest.
And I never hear that they get better sleep the next night either because of that information. However, it can help if you want to implement something for 10 days, something as simple as having a herbal tea 2 hours before bedtime and drinking a pint of water between half 5 and 7 o'clock the night before you sleep, and just seeing what the impact that is after 10 days. So actually taking 10 days off the data and then coming back into it is a really practical solution. So I kind of segued a little bit off the 3 hours, but the other thing that I would mention is with 3 hour meetings, someone needs to force the pause in that meeting, because everyone knows they shouldn't sit down for 3 hours. So someone needs to be courageous and say, at certain points in this meeting, we do need 5 minutes, and someone needs to take ownership of that and force that so people can move around, because people need to.
Yeah, or just make them stretch a bit, do a little stretching routine or something. Katie, you got any comments on that question at all?
No, I was actually going to say what John said around the use of technology and setting yourself kind of 50-minute chunks of time and just forcing yourself to get up. If you don't have a wearable, you can set a timer on your phone. There are ways you can do it to use technology to help.
Fabulous. Let's have a look what other questions we've got then. So, advice for employees with different abilities where walking or stairs might not be possible?
That's a really good one. And actually, I was giving this some thought earlier. There are lots of options for differently abled people, and one of the ones that we've trialed in various offices that I've worked in and been in is things like chair yoga. So chair yoga, I don't know if anyone's tried it, but it is as much of a workout as standing yoga. So there are some really great trainers that specialize in chair yoga and seated yoga for workspaces. So for me, that's a really obvious and easy one that you could start thinking about for people.
Lovely. And any suggestions for challenges with employees with disabilities at all? John?
Yeah, so again, referring to the last question, I think it covers this question as well.
Yeah, it sort of covers them both, doesn't it?
Yeah, I think the technology has aided that space a little bit more. So again, our reset and recovery spaces now have things like air boots or compression boots that allow, again, to increase blood flow within the peripheries to again just kind of give a little bit of a pickup when you are feeling a little bit lagging, I suppose, when you get into the afternoon. I think now, we see a lot in our active spaces that equipment that's more accessible Again, that caters for these for disabilities. That there is more equipment available on the market, and I think being disability aware is really important for employers when they look at what active spaces that they're going to offer their employees, or accessibility to spaces that allows them to move more. I think that's is a really important part of building a strategic approach to well-being for employees.
100%.
Can I just add something to that? I think, you know, ask people. You know, people are differently able. People do have different preferences and needs. And actually, the one way that you know that you're going to support people in the way that they need is to ask them what they need. You know, that's kind of a #1 principle, isn't it? Involve your stakeholders, whoever they are. So I think the quickest way to support people, if you're not sure, is to ask them what they need.
Yeah, definitely. And that leads us on to nicely to the next question, actually, Kathy. So what conversation tips can you give for broaching the subject of coping with mental health, and for people who may not want to open up? I think you're the expert on this. You've taught me very well. So what tips can you give us?
Yeah, it's quite a broad question, that, really, because it really depends on the context. And I think what I would say is that the biggest things are, remember, empathy goes a long way. Yeah. So first of all, start with what you've noticed. I have noticed that. Be factual and say, yeah, I've noticed that you don't seem yourself at the moment. Is something bothering you? You might have to ask more than once. So you might have to ask once and they go, oh, no, I'm fine. I don't want to talk about it. And then you have to ask again. If you have to ask 3 times, it may be you're not the right person, or it's not the right time, or they don't actually trust because the culture is such that it's not set up in a way where people are okay to talk about their mental health in the same way that they talk about their physical health. So I think there's a few variables in this. I would ask 3 times, and then if they're not opening up, I would say, look, I am still concerned about you. I appreciate I may not be the right person, but I can put you in contact with, and then you might have mental health first aiders, or you might have an employee assistance program. So there are lots of places you can signpost people within your organisation. Know what they are, of course, if you're not the right person for them, which does happen. And then I think if you keep asking them, and you've asked them several times, and they don't want to talk to anyone else, then really you just need to leave it, because it may not be the right time for them. And unless there's a crisis, we don't need to keep nudging people. It's like, whoa, just, you know, leave me be. And then sometimes people need to build trust with you as well. So are you really the right person for me to be speaking to? Because I'm not really sure. You know, it can take a while. But I think the biggest tip for always is, remember, you haven't got to fix people, just be empathic. Be empathic and kind and compassionate, and it goes a long, long way towards people feeling that they can trust you and open up.
It's just listening, I think, isn't it? And letting them open up, you know, rather than interrupting, or, you know, like you said, just be that empathetic person. It leads us nicely on to the next question as well. So I know that with the mental health for managers course that's just come out, and I've had lots of great feedback on this. So how can managers lead by example then, Kathy? And then we'll ask the rest of the audience.
Yeah, how can managers lead by example? Well, I almost want to be slightly flippant there and go, well, by setting an example. You know, managers are role models, aren't they? And so whatever they do, so for example, if you work 50 hours a week and you send emails at 12 o'clock at night and you're expecting it to be answered at 7 o'clock in the morning, then that's not role modeling good behavior, is it? It's not role modeling a good example of creating a well-being culture. So just think about what you're doing, because people will be looking for you, particularly new people coming in, and they will follow your lead. You will set the culture. So make sure that you are leading by example.
Definitely.
Yeah.
Anybody else got any thoughts on that one?
Yeah, I'll just add something there. there are opportunities to reinforce what are good behaviours, I think, from a wellbeing perspective. So one is if you do it yourself, you make the time during the day in the diary to go out and focus on well-being, and people are aware that during a certain time during the day, 2:30 till 3, that's the time that you go for a walk, and you're not actually going to be available during that half an hour. I've had it before as well, where someone said, you know, I've got a hospital appointment in the morning. Is it okay to take that time back and work further? I said, you know, for me, it's, you don't need to ask me, just let me know, just inform me that, you know, you're going to be out, so I can let other people know if they're looking for where you are. But it's not about getting permission to do things. You know, you have that ownership to do that, and just reinforce that when you get the opportunity to.
There's so many questions coming. I wish we had time to answer them all. I'll do one more. Let's have a look. So how do you measure the impact, somebody's asking? So how do you know if you've created a culture of movement, and what employee metrics could you measure? Kate, do you want to take this one?
I take that one. Yeah, that's great. I love it when people start talking about impact. They're talking my language.
I could see you smiling then.
Well, as John will know, because he's heard me say it millions of times, I always, whenever I'm talking to our clients, I always say something along the lines of, you can't improve what you don't measure. And so understanding where you are and where you want to get to and how you're going to get there is really critically important. And I think, again, we've already said it today, but talking to people, so being really clever in how you use, whether it's employee surveys or focus groups or interviews, to collect data around what people are doing. Obviously, you can use objective measures, so things like how often people go to the gym, how often they participate in physical activity, what kind of physical activity they do. So is it cardio, getting their heart pumping, or is it strength training, for example? You can ask them to tell you how much they're doing. You can ask people to tell you how much they're sitting down every day. And then you can put, you know, interventions and programs in place and see if you can influence those things in a meaningful way. You know, at Westfield Health, we do annual wellbeing surveys. We're constantly asking our people about their levels of engagement, their levels of physical activity, their emotional well-being. So we're constantly kind of looking at the data to tell us where our workforce is at and take a kind of temperature check, if you like. There are also organisational measures like sickness absence and presenteeism. But in the end, it comes down to talking to people, collecting data, and then using that data to make really informed decisions about the type of activity that you're encouraging.
That's amazing, Kate. I knew you'd be the right one to answer that one as well. And there's just one more. I think we'll answer one more, guys, and then we'll have to wrap up. Let's have a look. So for employees that do a very physical but repetitive role, often on a shift pattern, how would you encourage and highlight the links between physical health and mental health? Who wants to answer this one?
I'll start, but then Kathy, I'll push this one onto you as well. Like I think sometimes we think that the job, if the job's, the problem is the job isn't active enough. So when we do have jobs that are active, it's how we look after ourselves. So this is where you get you see a lot of musculoskeletal issues, is the repetitive nature of the physical activity actually causes a lot of muscular problems, and you spend a lot of time trying to deal with those problems, and again, it being an actual burden on the business. So if you think of something like private medical insurance and the premiums that a business pays because of some of these things, actually making sure we've got provision to again focus on being able to allow people to recover properly is really important. And again, some of those insights into what that particular workforce is feeling is really important. So that would be my take, is if the physical activity is high through the job role, how are we helping people to recover properly?
Yeah.
Yeah, and it points to, doesn't it, as well, the managers knowing their people and being willing to have those sometimes more difficult conversations about how you're feeling. You know, when do people actually say, well, how are you actually feeling about what you're doing? When are you recovering? What do you do when you're not working? Do we know that? So we know what they're doing to counter this sort of fairly repetitive role that's very physical. So I think it is really important. And just something I wanted to add to what Kate was talking about earlier, and I've just seen, I've got a little note on this. When you talk about metrics and measurement, you know, Deloitte did some research on mental health and employers and the case for investment into mental health, and this will be physical health as well, that it puts an average of £5.30 for every pound invested in employee well-being. Pretty impressive, that, isn't it? £5.30 for every pound invested in employee well-being. So if anyone's in any doubt whatsoever, then there's a trick for you.
That's amazing. There's some great advice there from all of you. Thank you all so much. Unfortunately, we are out of time. So just before we wrap up the webinar, I just wanted to ask the panel for your key takeaways that you want the audience to take away from this webinar. Quickly.
Take the first step, even if it's only from the couch to the fridge and back. Yeah. Moving matters.
Good advice.
Mine would be listen to the voice of your people. Ask them what they want. They will engage if they feel involved and they feel heard.
100%. John?
I'd go with write this down instead of I would, but I will, however, and try and find what barriers are preventing you from doing activity at the moment.
Fabulous. Thank you all so very much. Obviously, with loads of conversation, we have run out of time. So thank you everyone for taking time to join our panelists and for sharing their expertise. Some really great information. We're really sorry that you didn't get a chance to answer all your questions, and we'll do some follow-up blogs on our website and try and cover some of the common questions. Don't forget to download the handouts. We'd appreciate your feedback via our survey that will appear on your screen now. And if you'd like to speak to one of our health and wellbeing consultants about supporting the wellbeing in your organisation, then please speak with your account manager if you have one, or contact us via email, businessinquiries@westfieldhealth.com. You'd also receive an email shortly with a recording of the webinar. Thank you all very much for your time. Goodbye.
Thanks, everyone.
Thank you.
Bye.